Hello friends, in this video we are going to learn about the arches of the foot. So arches of foot, let us classify into two types, longitudinal arches and transverse arch. So longitudinal arch are two types, medial longitudinal arch and lateral longitudinal arch, and transverse arch are two types, anterior transverse arch and posterior transverse arch. So let us see one by one. First of all, let us see the formation of the longitudinal arch, medial longitudinal arch and the lateral longitudinal arch, as I already mentioned before. So what are all the bones forming the medial and the lateral longitudinal arches are? There are 9 bones forming the medial longitudinal arch and there are 4 bones forming the lateral longitudinal arch. So the bones are calcaneum, thallus, navicular, cuneiform, 3 cuneiform. Okay, that means cuneiform are 3 in number. Next, medial 3 metatarsal, first one, second one, third one. Okay, 3 metatarsals. Next, totally there are 9 bones which supplies the or forms the medial longitudinal arch. Okay, next lateral longitudinal arch is formed by the calcaneum, cuboid, 4th and the 5th metatarsal. Okay, this is what forms the lateral longitudinal arch. Okay, next anterior end, posterior end, anterior pillar and summit and the main joint. Okay, these are all the differences, okay, that forms the or boundary between the medial longitudinal arch and the lateral longitudinal arch. Let us see one by one. So anterior end is formed by the heads of the first 3 metatarsals. Okay, anterior end is formed by the heads of the first 3 metatarsals, and lateral is formed by lateral longitudinal arch is formed by anterior end. Okay, heads of the 4th and the 5th, last 2 metatarsal. This is first 3 metatarsal and this is last 2 metatarsals. Okay, the posterior end is formed by the medial tubercle of the calcaneum, okay, for the medial longitudinal arch, and lateral tubercle of the calcaneum for the lateral longitudinal arch. Okay, next anterior pillar anterior pillar is formed by the which are remaining all bones forms the anterior pillar. Here also remaining all bones forms the anterior pillar. Okay, now posterior pillar is formed by the medial half of the calcaneum for the medial longitudinal arch and lateral half of the calcaneum for the lateral longitudinal arch. Okay, next summit is, okay, for the medial longitudinal arch the summit is thallus bone, and for the lateral longitudinal arch it is superior surface of the calcaneum. Okay, next the main joint here is thalo-calcaneo-navicular joint. Okay, the joint which is present between the thallus, calcaneum and the navicular, okay, navicular bone. So thalo-calcaneo-navicular joint. Next here calcaneo-cuboid joint, okay, between the calcaneum and the cuboid bone. Okay, this is what the formation of longitudinal arch is. Next, let us see the factors maintaining the arches. So for factors maintaining, let us see there are 4 factors which maintains the medial and the longitudinal arch. First one is tie beam, intersegmental ties, slings and keystone. Okay, let us see one by one. So what is meant by tie beam? Tie beam is nothing but that connects the anterior and the posterior end of the arches. Okay, it connects the posterior and the anterior ends of the arches. So for medial longitudinal arch, it is the tie beam is plantar aponeurosis, particularly the medial part of the plantar aponeurosis. For lateral longitudinal arch, lateral part of the plantar aponeurosis. The only difference here is the medial part for medial longitudinal arch and the lateral part is for the lateral longitudinal arch. Next, intersegmental ties, which is nothing but the main ligaments. For medial longitudinal ligament, the spring ligament acts as the intersegmental ties. For the lateral ligament, lateral longitudinal arch, long and the short plantar ligaments acts as the main intersegmental ties. Okay, next let us see the slings. Slings are used for the upward pull. Okay, the slings particularly for the medial longitudinal arch is by the tibialis anterior and the tibialis posterior. Okay, 2 muscles, tibialis anterior and tibialis posterior. For lateral longitudinal arch, peroneus brevis and peroneus longus, 2 muscles. Okay, here also 2, here also 2. Now keystone, the keystone, okay, keystone bone, which is forms the keystone bone of the medial longitudinal arch, is nothing but thallus. For lateral longitudinal arch, it is cuboid bone. Okay, next formation of the transverse arches. So anterior transverse arch, posterior transverse arch, as I said before itself already. So anterior transverse arch is formed by the head of all 3 metatarsals. Okay, all metatarsals, heads of the all metatarsal, this is important. And posterior transverse arch is by the bases of all metatarsal. So anterior is formed by the heads of all metatarsals and posterior transverse arch is formed by the bases of all metatarsals. Okay, this is heads and this is bases. Okay, now let us see one note point. So transverse arch is complete when both feet are brought together. So once again, the transverse arch is complete when both feet are brought together. Okay. So let us see the functions of arches now. So there are four important functions of arches. So first function is distribution of the body weight. Next one is protection of the plantar vessels and nerves from injury, and helps in the locomotion, and helps in as a shock absorber or help. So next let us see the applied aspects. First, I have given three applied aspects here which are most important for the arches of the foot. So let us see one by one. First one is pes planus, pes cavus and thallipus equinovarus. Okay, pes planus, pes cavus and thallipus equinovarus. Okay, let us see one by one. Pes planus, which is nothing but flat foot. Okay, which is caused due to the collapse of the longitudinal arch of the foot. Okay, as we already seen before, lateral arch, longitudinal arch. Okay, due to the collapse of the longitudinal arches of the foot, pes planus is caused. Okay, now pes cavus, it is due to increased concavity of the arches. So concavity of the arches will be increased. Okay, so which causes the exaggeration of the arches, so which causes the pes cavus. Okay, now thallipus equinovarus, which is nothing but which is plantar flexed and inverted foot is seen. The foot is plantar flexed and inverted. Okay, thallipus equinovarus is seen. Okay, so in this video we have been clearly learnt about the arches of the foot and its types and subdivisions of its types. Okay, so thank you for watching.